deeds are. And I demonstrate throughout the book the both positive and negative effects that the words and deeds of a caregiver, a physician, a nurse, a chiropractor, naturopath, that their ideas can have on your health and healing. Um, what I'd like to do today is sort of extract from my experience and from what I teach caregivers, extract what I think would be useful information for you. And I'll do it by telling a series of illustrative stories along the way. I'd like to begin first with a quote that's now over 500 years old, and it comes from a doctor who had a name far too long to pronounce, but who's come to be known as Paracelsus. And let me read that to you as a starting point for our talk. Um, Mankind has received from nature both the destroyer of health and the preserver of health. What the first, the destroyer, strives to shatter and destroy, the innate physician repairs. Now, we hear things like that said not uncommonly. And especially we hear about the healer within. What I'd like to do, though, is deal with both the destroyer and the preserver, beginning with the negative stuff, and then hopefully ending on an up note with the preserver, your healer within, and the extraordinary capacities that I think we all possess and that we all can conjure with a little practice to help us stay healthy and well. So let's begin with the destroyer, if you will. And remember, this is about the impact of ideas. So of course, we know there are other things that can mess with our health, bacteria, viruses, all kinds of toxic agents out there. But today I'm focusing simply on ideas. And what I'd like to do is divide it up into ideas that come from outside and ideas that come from within, beginning with those that come from without. And I call, as Hugh and those who might have read the book now, I call these kinds of negative ideas that come from without curses. And as I said, I spent a lot of time trying to teach docs and nurses and others how to not inadvertently curse their patients. And let me give you one example of why from very early in my career. And this story involves a 32-year-old lady whose name was Eris. She was quite beautiful, the mother of two, happily married, wonderful guy as her husband. And as I said this at the very beginning of my hypnotherapy career, I'd been doing emergency medicine for 5 or 6 years, I think. And then I started a private medical hypnosis practice. And she walked in and said, I have an unusual request for you. I've just been diagnosed with a very bad kind of breast cancer. And I have to undergo chemotherapy, and I'd like to keep my hair. And she said, I don't want you to think that I'm vain. It's not that. It's that my hair is going to, in essence, be a symbol of my grace and my beauty as I work my way through this, whatever the eventual outcome. Seems unusual. Most people nowadays that I see with cancer, of course, have sort of broader goals, and especially survival goals. But she wanted to keep her hair. It was key to her. And this was back in the mid 80s when cancer chemotherapy was especially brutal, and especially for her kind of cancer. Could that possibly work? I asked myself. And then I remembered that in the minoxidil trials, the Rogaine trials, the placebo group, I'm going to come back to that in a little bit. The placebo group, actually 34 to 36% of people who just put essentially Vaseline on their scalp, they grew hair. And that's because the idea, if you do this, then you'll grow hair, had an impact on their health and healing, and in this case, all the way down to the molecular genetic level. So thinking of that, I decided I'd take her on and we'd work together. And work together we did. She was an excellent hypnotic subject. And after each chemo session, she'd defiantly go downstairs and have a massive cheeseburger and fries. She really never got sick from her chemo. She never, and I was with her on her last day, she never had a day of pain. And she kept her hair throughout the entire multiple courses of dramatic chemotherapy. Unfortunately, prior to seeing me, she had listened to a lecture at Scripps just down the road. And the lecture was given by an authority. And this is one of the themes I want to draw to your attention and focus on. An authority from Stanford. And he stood before several hundred people and pontificated everything he knew about breast cancer, which I should mention, if he were to give that talk today, would be outmoded and probably almost laughable because our modes of treatment have changed so much. After the lecture, Eris had gone up to this authority, feeling as she was, helpless and dependent with her diagnosis, hoping for some kind of good news. She told him her diagnosis, what was planned, and she said, "What do you think? What do I have in my future? Is there anything I can hope for that you're aware of?" And he reached out and he put his hand on her shoulder and he said, "Oh, my dear, I'm so sorry. At best, you have 2 years to live. Best put your affairs in order." That's a curse. That's a terrible curse. And I'll tell you as a physician that it's an impossible forecast coming from him, because I hope you all know there's not a doctor you ask that question of, what's my tomorrow, who can answer to you even what your tomorrow is. We're not forecasters of the future. We're just possessors of statistical information and skewed experience. But frequently, when people are helpless and dependent, whatever the cause, it could be an auto accident, it could be childhood, or it could be an adult in some kind of health distress. When we're helpless and dependent, authorities, the one least uncertain, have the potential to have a tremendously devastating impact on our health and on our lives, as this man did with Eris, who, despite everything I told you, keeping her hair, gracefully moving through it, exemplary in every way, died exactly 2 years and 1 day after he stretched out his hand and cast that curse. Ideas from without. You with me so far? Now, that's a pretty dramatic example of a curse. And I'm going to come to how to deal with that in just a moment. But there are much less subtle examples that go on each and every day, thousands, perhaps even millions of times a day. I call it the curse of chronicity. When a doctor or caregiver of some sort or other turns to you and says, "This is your diagnosis. Unfortunately, there is no cure. You will just have to learn to live with it." Now, that's a little bit more subtle. But if you think about it, it's a pretty horrible thing to say, and it's actually a pretty stupid thing to say. You never know as a physician what the next thing down the road will be in terms of cures. There are people, I'll tell you this, today who sadly are being diagnosed with ALS, and they're being told by those same practitioners, you have 2 to 4 years to live, which is impossible. That's the fallacy of prophecy. It's impossible to know that, but they are being told that. And yet I know that in some rat lab at Northwestern University, there are scientists today who are working on a protein that in their rat model has reversed ALS. So what other surprises do we have? Just look at what immunologic therapy has done for cancer treatment. And what else comes tomorrow and the next day and the next? So to say you'll just have to learn to live with it deprives someone of that hope that there's something perhaps around the corner tomorrow or the next day or the next. And that's not the right way to say it, right? Before I give you your diagnosis, let me tell you something. In all my years of practice, the one thing I know for certain is that I don't know what's coming tomorrow, but I see miracles happen every day. I really, literally do. And I have no idea of knowing whether you are the next miracle I'm going to witness. I'm going to be with you. We're going to work through this. And in the meantime, here are the measures we will take. Something like that is much better than just the stuffy curse of chronicity. Ideas from without and their impact on health and healing. Now you can wonder, like, how far and how deep can an idea stretch? What can it actually affect? Of course, I understand how an idea might give somebody high blood pressure or anxiety, but those are psychological things. Is there any evidence that these have actual material effects on us? Any evidence at all? Well, I don't know if you've thought about it this way, but I'll ask you to do it with me. In the last more than 70 years, there have been over tens of thousands of placebo-controlled experiments. And in all those experiments, they don't tell you only the potential benefit of placebo, but also the potential risks. And it's really interesting to see that. But think about it. Telling the potential risks is just lofting up an idea. It's an idea, but it's not an idea from some random person, is it? It's an idea from some white-coated authority. If you take this pill, you could have nausea, you could have vomiting, you could have diarrhea. You could have all these other effects. In 1983, in the World Journal of Surgery, think about this one. People who were undergoing a new kind of cancer chemotherapy were randomly assigned to receive either the therapy or a placebo. And they were all told that if you get the therapy, if you get the, quote, potential cure, then you will lose your hair. Now, I like to pause at that point and think about what this really means. I told you about the flip side of the Rogaine experiments, but think about this. Here somebody is given a placebo, and they're told that it'll either be a placebo or the real thing, and if it's the real thing, you will lose your hair. And 31% of the people in the placebo side who got that idea from without, from an authority, 31%, almost 1 out of 3 of those people lost their hair. The genetic machinery for hair production, very much like as I'm looking at this, has happened in this part of my growing forehead, has shut down just as a consequence of an idea. But not just any idea, an idea promulgated by an authority, right? If you walk by some schizophrenic ranting on the corner, and he says, oh, your hair's going to fall out, or you're going to get sick, or something or other, that won't have any effect on you whatsoever. That person has no authority in your life. But when people feel helpless and dependent and turn to the one they deem the least uncertain, what they do is they vest that person with a certain power, a hypnotic influence, if you will, that really can adversely or positively affect their health. And so here's lesson number 1 from our talk. Don't give authority to people in matters of your health. Don't concede that. You don't need to do that. It's fine to be respectful toward a doctor if you feel that way. But what's most important is that you regard your caretakers as consultants, useful consultants. And as soon as their usefulness is done, you can discharge them. If you're in conflict with them, discharge them. Recognize that they have, by virtue of their position, a certain power, and that you're not okay with them misspeaking. And if they are those kinds of negative people, get away from them and repudiate that by knowing that someone who talks in curses, even inadvertently, has a lot more to learn, and they can't possibly predict your future. This next thing I'll suggest to you as part of this lesson is hard to do. I know it's hard to do. I've been impatient myself. But what you want to tell or communicate to your caregivers is that you want positive, healthful ideas. You don't want curses. You don't want negative suggestions. In the book, I teach doctors how to give information honestly. And some of the information is negative, right? How do you give it honestly without cursing the patient? It's so simple. Watch this. Let's say I'm giving a pill and it has nausea and vomiting as a potential side effect. And let's say that even 80% of people can have that side effect. Here's the way I would do it. You got to watch my hands and even my eyes as I do this, okay? So here's the pill I'm recommending. And as you know, it's my obligation to give you both the pros and cons of this pill. I'm abbreviating this thing, so it won't be quite as smooth. But let's do the negatives first. It's important for you to know that there's a large number of people. Now look what I just did. I said people, not you. And I put my hand out there. But when they take this pill, might, not meaning will, but could or could not, might have nausea and vomiting. Roughly 8 out of 10 sometimes. On the other hand, there are some 20% of people, perhaps very much like you, who, now I'm going to throw something in there, a little tricky, but just watch how it goes, who, Hugh, take this pill and have a perfectly comfortable experience with it. Of course, we don't know which one you'll be. So why don't you call me tomorrow and let me know how well you feel? Honest, straightforward information. Some people have complications. Others, perhaps like you, do not. Call me and let me know how well you feel. You can write something down, very polite, and say, dear doctor, I feel a little vulnerable to suggestions. Let me ask you to kindly guard your words and speak in positives to me. I don't want negative suggestions at this vulnerable time in my life. Thank you very much. And hand that to the nurse on the way in. Don't vest authority in your caregivers. Respect. Use them. Even an alliance is important and hope is important. But you're not at their mercy. Because none of us as physicians have been taught how to speak properly. And therefore, almost all of us, except the most intuitive, will inadvertently, even out of compassion, make mistakes. So guard yourself against that. That's ideas from without. Now, if you're with me, let's talk about ideas from within. And remember, we're talking about the destroyer. So I see a few grim faces out there, but I promise we're coming to the preserver of health right after this little piece. With me? Now, how do you find out what ideas a person has that might somehow contribute to their ill health? Because step one is discover it. And then step two is treat it. And in terms of treating it, I won't do that here. I don't have time. But that's what my book actually focuses on in the latter half. for caregivers. It turns out there's a magic question you can ask anyone. And if you ask it right, you can find out what the contributory causes, mental causes of their illness are, if there are contributory mental causes. Frequently there are, but I don't want you to misunderstand me and think that I'm claiming everything is mental. That's no more likely than everything is material. In fact, in my experience, broadly speaking, it's a mix. So my question is, what are the noetic, what are the psychological contributory causes to an illness? And very early on in my career, I learned that once the diagnosis is secure and you've gotten that taken care of, the most important question that you can ask is, why today? Somebody has a heart attack. You get them all stabilized. Everything is done. Everything is quiet. You're waiting for a bed to the ICU. I walk up to them and ask, say it's some guy named John. John, I suppose you could have had this, 2 days ago, or 2 days from now, or even 2 years from now, or not at all. I know you don't know the meaning or the reason for this, and I don't know the reason. But if you had to guess, see, I'm asking this in a very particular way. If you had to guess, why today? And then you have to do something that's tough for docs to do. You have to shut up and listen. And sometimes that gap in there is kind of long. The first response comes back quickly. It's always this: gee, I don't know. You're the doctor. I have no idea. But then you go back to them with, well, I know you don't know, like I said, and I am the doctor, but I don't know either. I'm just saying, just guess. And then if you're quiet enough, you're going to find out what's going on. He may say something like, I have no idea, but do you think it has anything to do with the fact that my mother-in-law just moved in and she plans to stay for the next 15 months? There's your hint at one cause, right? One contributory cause. Or somebody has I had a guy with a male genital problem, minor. Fixed him up, got him all referred. Why today? Yeah, I don't know, doc. Do you think it has anything to do with the vasectomy my wife wants me to get tomorrow? Or somebody who comes in with cold sores up here, a cluster of cold sores. Why today? I don't know. You think that's going to interfere with the wisdom tooth removal I'm scheduled for tomorrow? And so on and so forth. So when asking questions like this, over thousands and thousands of patients, it became ultimately clear to me that there were a few broad categories of responses that constantly come forward. And I want to share those with you because they're important to know, and they're important to get out of your system if you have them, or to help someone you love get rid of them. Now, the first category of these negative ideas from within is what I call baleful wishes. These are unhealthy wishes. And they come in many forms. I'll give you 3 quick notions here. The most dangerous wish anyone can have is what I call the no matter what wish. I got to get out of this relationship no matter what. I've got to get out of this job no matter what. I've got to get out of this situation no matter what. When you no matter what it, you're basically saying to your unconscious, you go find a symptom, you go find anything, I don't care what it is, just get me out of this. And the problem with that, as you can well imagine, is that not uncommonly that results in serious illness. There are a lot of people who have been in jobs that they want to retire but can't retire, or their finances are stressful, or something's going on. And they go, God, I got to get out of this job no matter what. And their unconscious is listening. And they end up with all the many things I've seen. They have the heart attack, or they have some terrible cellular diagnosis, or an autoimmune condition, or crippling arthritis. There's an old saying, be careful what you wish, be careful how you wish. Don't wish no matter what, be specific. And I'll tell you how in just a minute. The other common kinds of baleful wishes are, first, what I call retreat into illness. As kids, think about it. Childhood's this time of very limited choice. We didn't have a whole lot of choice back in the day. And yet that oral report, or the bully, or the whatever the potentially humiliating experience at school was, we really wanted to get out of. Now, not everyone listening to this did that, but most of you did this. You wake up the next day and lo and behold, you've got a sore throat, or a tummy ache, or a headache, or an actual fever, because you've really decided you've got to get out of this thing. You're not going to school, but you can't sit there with your folks and just say, you know, this guy, Gary guy, is really bothering me, and I'd rather just stay home and read. And they're going to say, you're off to school, kid. And so you stay home and you get reinforced. You get exactly what you want. It's positive reinforcement. And then it happens again, and perhaps again. It becomes a conditioned response. This retreat into illness idea from within that puts a young kid in a sick bed for a day, but can put an older person in a sick bed permanently. It's not okay to retreat into illness, and people do it all the time. In my private practice, I see it every day. You can't do that anymore, right? And while you may be saying to yourself, oh, that's not me, I don't have it. Well, maybe not. But when I ask people, why today, why now? The answer frequently comes, I don't know, you think I'm trying to get out of this, or think I'm trying to get out of that? That's a retreat into illness. And the final of the three baleful wishes that recur so commonly in my practice is guilt. And that may surprise some of you, because we think of guilt, we feel that sort of horrible regret and shame for having done something wrong. But that's not what guilt is, not in a Judeo-Christian culture. It's part of what it is. The other part is frequently unconscious, an unconscious wish, dangerous wishes, an unconscious wish for punishment. And so I've seen, at one point in my career, I had 5 cases in a row that were guilt-engendered illness, right? You have to look for that, find it if you have it, and root it out. And if you can't do it yourself, find someone who will help you with that. It's not hard. Chances are you've suffered enough. You can let that go. You don't need any more adverse consequences. So baleful wishes are ideas from within that can really do harm to people. And I caution you against those. It's not be careful what you wish, be careful how you wish. Wish for only healthy solutions and only healthy cells. I need to get out of this in a healthful way. The other common ideas from within that I won't have time really today to elaborate, but which are so common, I literally do see these also on a daily basis, are what I call dangerous identifications. We're all identified in childhood with a parent or a mentor or somebody important, and we have to be. We have to learn, we have to survive childhood and get to the point where we have the open playing field of adulthood, where we have these wide choices that we can make. But you all must recognize that whoever you identified with, even if it was a parent who you still love and adore and who's perfect, and if you had that, lucky you, right? Their path down the road to happiness, in all likelihood, is not going to be yours. And if you stay on it too long, too far, then you end up in a place where you're not happy. and where dangerous wishes may occur, and where a retreat into illness might happen. And so disidentification with love and respect and gratitude is one of the ways to health. And most healthy people have already done that in one way or another. Dangerous identifications. And I could give you many stories on that to illustrate it. Perhaps I will in the Q&A. But I'm just touching on these briefly as we go. And the final category of dangerous ideas from within that I see recurrently are these conditioning events that get generalized. Now think of this. Most of us had a time back in our life where we got hold of some booze. We had no experience with that. We chugged whatever it was, scotch, bourbon, tequila, and we spent the rest of the evening puking our guts out in the bushes. And the original lesson of that, as we took it, was I'm off alcohol for life. And then that kind of degeneralizes down to I'm off that tequila for life. And for many of us, it stays that way. Well, that same type of generalization Pavlov talked about, and it happens to all of us. And it can happen as a result of some kind of early childhood trauma or later trauma. The real lesson was no, when you're 14 and you don't know the warning signs of excess drinking, and you don't even know how to drink, don't grab a bottle of tequila and chug half of it before you realize what you're feeling. When you're 14, take it slow, engage, have an adult there, and be careful. When you're older, you'll learn the warning signs and you'll learn how to control it. So as a matter of fact, don't even do it when you're 14. Wait till you have a forebrain and you can make some wiser choices. That's the lesson, basically. You don't have to generalize it to all alcohol or to tequila. It's a lesson for a 14-year-old how to take care of himself in the presence of a toxin. And that same sort of analogy holds for many, many of the traumas that people generalize that result in illness. Again, the best thing you can tell yourself in the absence of any controverting unconscious ideas is only healthy solutions. I want only healthy solutions from now on. And you're telling that to your unconscious, which is immensely powerful. And let me give you a couple examples of that as we turn quickly now to the preserver of health. How do ideas preserve health? How powerful are they? What's the limit? What can we do to make sure that we conjure forth, that we invoke those powers to help us stay healthy? That's really the big question, isn't it? You with me? Let me tell you this story, and this is, I heard somebody saying they're having surgery. I want to tell you a story from my experience with pre-surgical hypnosis. And I'll tell you, just because it's fresh, the one that just happened most recently in my experience. Hugh, I might have told you this one. Somebody that I love, somebody who's working in my household, came to me and said, I've got colon cancer I have to get operated on next Thursday. And let's call her Gladys. I hope I remember that made up name. Okay. So Gladys, I'm sorry to hear that. I'd love to help. Would you consider letting me meet with you in the office on Wednesday night? She's having Thursday on Thursday morning. And we could do some pre-surgical hypnosis. She says, sure. Now, this is a person who knows me really well. She knows my faults and my foibles and my stupidities. And I don't really have very much authority with her. At least I don't perceive that I do, other than she knows I have an MD, which carries some marginal weight, maybe. So we go to the office. I spend an hour and a half with her, do a hypnotic induction, and offer 3 agreed upon ideas These are ideas from without. One is keep your own blood. You can't say don't bleed. You don't want to put in the negative. So keep your own blood, every drop. The other is delightfully surprising comfort, because everyone's a little skeptical. So it will surprise you. So much comfort that when you hear compassionate people asking about your pain, how's your pain? Do you want a pain medicine? On a scale from 1 to 10, how much pain do you have? The word pain itself will act as a trigger to promote even greater comfort, delightfully surprising comfort. And finally, number 3, really rapid wound healing, really rapid wound healing. In fact, wound healing so fast that when your doctor says, I need you back on day 10 to take your sutures or your staples out, don't do that. Make an excuse if you have to. I'm going to be on a vacation or something. I need to be there on day 8. Because when you go there on day 8, trust me, he'll say to you, gee, I'm glad you came early. I would have had to dig these out if you'd come 2 days later. So here's what happened with Gladys. She had a laparoscopic hemicolectomy, half her colon removed, and her lymph nodes were dissected. Okay. That surgery takes normally somewhere between 3 and 5 hours. She was done in 2 hours and 45 minutes. I saw her in recovery room. How are you, Gladys? Yeah, I'm fine. They're trying to give me medicine. I don't really want it. Okay, we'll just keep telling them no, thank you. The whole time that she was in the hospital, she took Tylenol only. This after half her bowel was removed and lymph nodes were explored. Tylenol only, not unusual. Almost every pre-surgical hypnosis patient that I've had has a story like this. Talk to the doctor the next day. Well, how much blood did she lose? Well, no, tell me. He goes, well, why are you mumbling? He said, well, I put 15 cc's, but I'll be honest with you, I didn't really see any blood. We didn't have any bleed. That too is common. I have people who have had both knees replaced, whose estimated blood loss was less than 30 cc's. That's almost impossible. And then Gladys goes to day, let's see, what was it, day 3, hour 70 in her stay. And I go to look at her wounds, and her wounds are completely healed to the point where they're heaped up. The scar looks like it's been there for a long, long time. I turn to the nurse and I say, have you ever seen this before? No, I've never seen anyone heal that fast. And she says, but that's not even the main thing. I said, well, tell me what the main thing is. And she said, well, at hour 12 post-surgery, she had a normal bowel movement, meaning everything inside had healed sufficiently, with sufficient speed, from just 3 ideas that were planted in a hypnotherapy session, that she had normal return of bowel function in 12 hours, went home at 72 hours, has done great ever since. Common. My common experience over 35 years with pre-surgical hypnosis, the impact of ideas on health and healing, right? There Gladys was, helpless and dependent, right? The night before surgery. And there I was, inducing a trance so I would have more authority. That's the only reason you need trance. And suggesting 3 ideas that she accepted in and that clearly worked for her. Now, how far can this go? Well, before I tell you how far it goes, think about this. That story I just told you tells you that the sensory system, the vascular system, and the various healing systems within the body are all amenable to suggestion. They're all susceptible to influence the impact of ideas on your health and your healing. 2 more quick ones. I had a patient named Althea. This was after Eris, the one I told you about who wanted to keep her hair. And she came in and said, I need you to cure me. You're the one. And I was very young. I had no experience curing anyone with cancer at that point. She goes, I know you're the one. I said, well, how do you know? And she said, well, I just met this Indian guru and he put his hand on me. I told him my diagnosis, put his hand on me and said, you'll be all right. You'll find somebody. And later that day, somebody was talking about you. I know you're it. I said, well, Althea, what's the problem? Althea had an 8-inch, not 8 centimeter, an 8-inch pelvic lymphoma biopsy. Slide sent to Stanford and UCSD. While the biopsy wound was healing, she couldn't undergo chemo, so she decided she'd see me. And I used a technique that I learned from a great man, Ainsley Mears from Melbourne, Australia. Very simple technique. And I had no idea whether it was working or not. We had 6 quick sessions together inside of 2 weeks. And then she went off to start chemo. And in order to start chemo, they did an ultrasound, but they couldn't find the tumor on ultrasound. So they sent her for a CAT scan, but they couldn't find the tumor on a CAT scan. So this is long ago. They sent her to MD Anderson in Texas for a PET scan, and the tumor was gone. And Christy White called me up and said, Steve, what the hell are you doing? I still didn't know what was going on. So I was a little apologetic. I go, I'm not doing anything, Christy, just positive suggestions, a little hypnosis. And then she said, well, whatever you're doing, keep doing it, because this tumor has disappeared. We've never seen anything like it. We're going to tumor board on Tuesday. Think about that. What was the idea? Was it the idea that the guru as an authority implanted and that the hypnosis might have only helped along? Or was it the notion that I said, this is a technique by Dr. Mears. He has cured cancer with this. Let's do this. If you do this, then you will be well. You see, in all these placebo trials, just to wrap it up, 70 years, thousands, tens of thousands of trials. And a white-coated authority has said, if you take this pill, then you'll get well. If you undergo this procedure, then you'll get well. If you do this or do that, then you'll get well. And 25 to 35% of people in placebo groups, that external idea internalizes and they get well. And you ask me what the range of possibilities is. Is it just psychological? No. Placebo opens coronary arteries. It decreases the frequency dramatically of kidney stones, cholesterol. In fact, every single thing that's ever been looked at over the course of clinical trials, randomized controlled clinical trials, there's been a placebo effect. The impact of ideas on your health and healing is really hard to estimate. But the one thing that we know from what I've just gone through with you is that ideas can have both positive effects across a broad range of maladies and negative effects, right? So in quick summary then, guard against authorities. Do not vest people with authority. Use them as consultants, right? Protect yourself. Introspect and be rid of unhealthy wishes and dangerous identifications, and be aware and constrict them down of early conditioning events that had a lesson then that need not be the same lesson now. Not so generalized. And then begin to use positive ideas. Not that affirmation always works, but it's a way to get started, especially in the absence of countercurrents, unconscious countercurrents. Use positive ideas like only healthful solutions and only healthy cells to inculcate inside your system, knowing that ideas do matter, right? Ideas do matter. And so with those, I hope you get some taste of what it is I'm about. and that it's at least spurred some thoughts. And if it's all right with Karen, I'll throw it open to questions.
Well, that was a phenomenal talk. And I'm going to get to my question in a second, but seriously, from a cancer survivor right here, and the sister of a stage 4 prostate cancer survivor, hope is a huge thing. And thank you for spreading it, because that's what we need. Okay, I'm going to ask my question first. What was the idea that you gave to the woman who had the 8-inch tumor that made it go away?
Well, as I said, I was very young and inexperienced at the time. And this method that Ainsley Mears used was essentially a nonverbal or near nonverbal induction. And he took people to a place that he described as crystal clear silence. And he let them hover in that space for as long as they would. It was frequently would begin 15 minutes, 20 minutes, but often it would end up being an hour or 2 hours. And with Eris, I would spend, as I do with most of my patients, hour and a half, 2 hours. But it's not so much the technicalities of what I did. You have to understand, and I hinted this, what placebo is and how it works, and then realize that what we're trying to do in noetic medicine and mind medicine is we're trying to accept the reality of placebo effects, but improve upon the 25 to 35% of responders to get closer, if we can, toward 100%. Every single placebo has the same structure of its suggestion. It's, I call it the generic placebo suggestion. It's if you do X, if you undergo the intervention, then Y, the prescribed outcome will occur. And if you think with that, of what I did was I induced a trance, took her through this experience, and then woke her up. But the overarching suggestion was, if you undergo this, then you will get well. And I know to many people that sounds so simple. How could that possibly work? But remember, that is what drives every single placebo response around the world all the time, whether it's happening in a shamanic ritual in the jungles of Ecuador, or whether it's happening up here at Scripps on Torrey Pines. That's inherent in every single encounter. If you use hypnotic technique to magnify your authority, to impress that the idea that this thing you're going through has curative effects, then it will have a curative effect. That's why so many modalities work. I'm not saying they don't have intrinsic value themselves, but the only way to know if they have something beyond placebo is to do a placebo-controlled trial, right? Let me finish with this. If you got 25 or 30% of placebo, of people with Altheia's cancer, or cured of that cancer, and then you tested that against another placebo and there was no difference, would you stop giving everyone placebo? Or would you make sure you gave everyone placebo and content yourself that at least 25 to 35% survive? Remember, it's not the pill, it's the idea.
Mm-hmm.
And that's where the power comes.
Okay, so Bill had a question, his hand up for a while. So go ahead, Bill.
Thank you, Doctor. That was an excellent presentation on healing. And I happen to be a chaplain over at Scripps Encinitas. And your description of what you did with patients before surgery reminds me of pre-surgical prayers that we chaplains are called on to do. And I'm wondering if you'd care to comment on the role of spirituality in healing, because it sounds to me like our prayers are much like what you're doing.
I worked at Scripps Encinitas for 20 years. I wonder if you were there when I was there. You look much younger. Let's leave it at that.
As a volunteer, yeah, your face is familiar too, but I was only a volunteer chaplain then. Now they hired me.
Oh, very good. Well, I'll address your question, but the first thing to understand is you're seeing patients who are in a state of helplessness and dependency, and you're a man of God. And so you carry with you, whether you like it or not, whether you wield it intentionally or not, inescapably, you carry the mantle of authority. So your words in and of themselves, okay, even before the spiritual aspect that inspires them, your words are potentially very, very impactful. It's almost nothing for you to say, you know, I have some patients very much like you who surprise everyone, and you could surprise everyone, and keep all your own blood and wake with delightfully surprising comfort, no matter what they say. It happens. So I have a whole chapter on that in my book on the nuances of how to do that more smoothly. But you don't have to be smooth. You have tremendous authority. In terms of spirituality and how that might magnify or intensify or even move these things to actualization, I think I'm probably the last person in the world who could claim any authority on knowing how that works. But I don't doubt for a minute that it plays a role. That's probably the best I can give you.
Thank you.
Any other?
Okay, other questions? We'll go to Greg and then go ahead, Greg.
I'm wondering if you had any comment or views about what the lockdown has done to people because of the pandemic, how that might be affecting people's health in the future.
Just broadly speaking, the effects of the lockdown.
Yes,
Well,
and the messages that are coming out on a daily basis about the pandemic.
right. Well, so I think anyone sensitive to both the positive effects and negative effects of ideas and how ideas can directly affect physical health and well-being as well as mental has been disappointed with the way, at least let's say, popular media has presented the predicament that we all found ourselves in this last year. A couple things that really pissed me off. I think it's important to understand when there is real risk, who's at risk, and what the risk mitigation techniques might be. I think that's very, very important, and that information needs to get out. And of course, the information is fluid, so the potential mortality of say 0.1% becomes 0.6%, becomes this for this group or that for that group. That's all very important, and I have no problem with the print media and television, radio putting it out. But it really, really aggravates me that survival statistics aren't given first, and that they're not given in the way I just showed you, where you say, you know, some people will have this problem. They tend to have this and this and this. And the percentage is, let's say, 1 out of 100. Other people, perhaps, Greg, very much like yourself, do really well. Remembering that 52% of people with COVID are asymptomatic. That's the most important thing to tell everyone. 52% of the general population who get this bug will be asymptomatic. So I've been troubled by the inability of the media to be honest. It's not honest to say we have 500,000 dead without saying we have 40 million who have survived it. That's one part. The part that bothers me, if I'm being completely honest with the local Rotary, that bothers me the most is the things that matter most for health and healing have been ignored by all the potentates, including Dr. Fauci, who I'm really angry at because he's putting the emphasis on the wrong syllable constantly. What do we need to survive this thing? I know most of you are vaccinated, and I'm happy for that. But look, there's going to be another and another. This is life, right? What do you need? I'll tell you what you already know. You need to sleep, number one. You need to put it all aside and get a restful night's sleep, get your 7, 8, 9 hours sleep. And if you don't get it, you need to take a nap, number one. Number two, you need to exercise. You need to move every day, whether you're lazy or not, whether it's cold or not. You need to get your ass off the chair and get out there and do something. Because when you do that, the unconscious hears the message as, oh, he wants that to keep working. Oh, he needs that to keep working. Oh, that's got to work. And so it puts messages into the unconscious that get acted on almost immediately. And the literature on this is extraordinary. Nobody could contest that. And you need sunshine. And you need sunshine without sunscreen. I'm sorry. Put it on your face and go take your shirt off or wear some shorts and get out there and get your vitamin D. And then in the midst of a pandemic, supplement it and make sure your vitamin D level is above 50. And that is incontrovertible. There are 9 great studies out there. And remember, here's the most important thing. If you have some quasi-scientist displaying his professorial skepticism about vitamin D, it's idiotic because there's no downside risk from getting your blood level up into the 50s. There just isn't. And the data is overwhelming that if you get it up, 50 to 60, even a little smidge higher, you probably won't contract it. But if you do, odds are it would be a mild case and you'd get the antibodies almost for free, right? And then there are a few other things you can do, but just think of it. How often have you heard ventilation? Get some HEPA filters in your office, make sure that you're keeping doors and windows open. Just these simple measures like that should be at the front end of everything Fauci is talking about. But he's talking about what this company or that company will do. And so I'm going to stop there, Greg, because you scratched a scab and I don't want to bleed all over you guys.
Well, that's a good answer though. For the orientation has got to be, be healthy and get healthy.
Yeah.
Okay. Any more? I'm sure there's more questions out there. Anybody else? I want to find out the name of your book, if you have one to tell us about, and so that we can, get more of you.
Right. So the book, I think I see it there. So here. Remember this book though, I'd love you guys to buy it, but you may or may not want to. It's Healing Beyond Pills and Potions. And it's written to teach professional caregivers how important their words and deeds are and how they influence health and healing. There are many sections in it, though, I will say, and I think Hugh knows this, where it's like as you read it, you're the fly on the wall and it'll begin to ring true. You'll hear these little pings of, oh, that's me, or I did that, or this is what I have to watch. And the epilogue in the back is addressed directly to patients. And it's available on Amazon as ebook and audio as well. So it's up to you. I got one review that I think said it right. I wish I had said it. It's a book that every patient should read once, but that every caregiver should read once a year. And that's my true goal. So if you buy it and you like it, when you're done with it, hand it to your doctor and say, you don't know this, but you need this.
Good suggestion. Okay, anybody else have any questions?
And
Thank you.
I don't have a question, but I just want to say it's a fantastic book. It's a fantastic book for anybody to read because it's so much about communication, verbal and nonverbal communication, how we affect ourselves, how we affect other people. And I enjoyed it so much that after reading the whole thing, now I'm listening to it. So I recommend it.
Thank you very much.
Thanks, Anne.
You're good.
Well, I know that my husband Warren, who is not, we can't see him right now, but I know that the word he heard in your the last part of your talk was nap, and so he's a great napper, and he does love his naps. But he is also a mover. He gets out every morning and moves and swims and golfs and all of that. So I know that he's going to say, "I told you so" when we get off this call.
I told you so. I told you so.
I'm with him.
Okay, well, everybody get out there and move.
Yeah.
Thank you
all.
so much.
Thank you. And you, thank you, and thank you very much.
Thank you,
Bye.
Steve.
Thank
Thank
you
you
very
so
much.
much.
Thank you.
Bye, everybody. See you next week.
Bye-bye.